Welcome back, everyone. As you can see, we're growing and expanding to new channels. So we're now on video. We're very, very excited. And for this bonus episode, we want to bring you a scoop of the latest news as it relates to mental health and AI, since this is what we talk about on here. So we're starting today with a major shift in mental health care coming out of Utah, where a new pilot program is allowing an AI chatbot to renew psychiatric prescriptions. This is essentially a direct response to a massive gap in the care where patients are currently waiting weeks or even months to just get an appointment. We've talked about this on our episodes as well. And essentially for $19 a month, the service targets patients who are already clinically stable on lower risk medications. So essentially what this is a 12-month pilot program in Utah, launched in early 2026, and it allows AI chatbot to renew certain psychiatric prescriptions without direct real-time approval from a human doctor. And
that was pretty cool.
it is pretty cool. This initiative was approved by Utah Office of Artificial Intelligence Policy. Now I'm wondering who knew that existed, but there you are, it exists. And it essentially aims to alleviate severe mental health provider shortages in the state, as we talked about. So here's what's happening here. It's basically being run by an organization called Legion Health under something called Utah's AI Sandbox, which basically allows controlled experimentation with fewer regulatory barriers.
Okay.
But the scope is actually pretty narrow. So this AI isn't diagnosing anything new or changing medications. It's only, as I mentioned before, allowed to renew low risk, non-controlled prescriptions. So we're talking like Prozac or Zoloft, and only if a human doctor already prescribed them.
Okay. I guess that's like their
Sorry about that.
guardrail or safety kind of thing, right?
Yeah, exactly. And there's also other safety checks, and we talk about safety checks on our episode a lot. So only clinically stable patients can use it, and the system actively screens for side effects or warnings, and if so, it are like warning signs. For instance, if you see worsening symptoms or suicidal thoughts, we've talked a lot about guardrails that we do our best to put in our prompts as well. So if anything like that concerning comes up, it immediately hands things off to a human clinician. They're also rolling it out pretty slowly, which I think is important to mention. So at first, every single case is reviewed by a doctor in real time, and only if AI proves itself as safe, it'll get a little bit more autonomy with ongoing audits and reporting. The big draw here, and I think you probably all figured it out, obviously, is access and cost, right? So it's only around $20 a month, and it's much, much, much faster than traditional care. But of course, like with everything, not everyone's convinced, and some clinicians are raising concerns about safety, the lack of human connection, and ultimately the risk that systems like this could be misused or ultimately over-relied on.
Fascinating. I mean, it's like we're already living in the future, right, folks?
I know.
It's hard to imagine that this is our reality, but here we are. And you know what? I mean, on one hand, I think it is clear that this is where we are moving. That sounds really efficient, but the medical community is already sounding the alarm. The American Psychiatric Association has already released a statement questioning the quality of care and who is actually accountable when things go wrong, for example, right?
Makes sense.
So there are folks from Utah that are doing research on these tools, and they are finding that this mostly serves worried well rather than actually the vulnerable populations who are falling through the cracks still. And just days ago, late April, the Utah Medical Licensing Board called for the immediate suspension of the Doctronic program. So it's the second program out of the two that they launched, saying they were never consulted before launch.
I totally hear your concerns, but I think let's talk about reality for a second. Like in the tech space, Everything is always moving quickly, and with this, it's no exception. So whether we're ready or not, things are happening. So for instance, just in March, Sword Health launched Dawn, which is an AI mental health tool built for 24/7 personalized support. We talked about how AI is great at that, being able to be there for you all the time. And what's interesting is actually how targeted it is. So unlike general AI, what they're saying is that Dawn is trained on huge amounts of real clinical data. So it's based on things like with usage of CPT, ACT, ACT, and DBT. So it's trying to really mirror actual therapeutic approaches, which is good. But
And these are actually the approaches we've discussed
I was
extensively
just
so
gonna
far in
say
this
that
podcast.
exactly.
I think, wait, we haven't gone through DBT
We did
yet,
not
have
go
we?
through
Okay.
DBT now.
So that's maybe something
CBT and
to
egg,
ignore.
though.
Yeah, we're gonna deal with that one. All right, so back to the Dawn. So it actually goes beyond just reacting. So they also say some really interesting features, I thought. Like it said it can connect to things like your calendar or even your wearables. So what that means is in real time, for instance, it can step in and suggest a breathing exercise if it feels maybe it's your heart rate's going spiking and you're like, oh, it's a stressful meeting, your heart rate spikes. It's going to be like, hey, let's do a breathing exercise, and it can like react in real time to you.
That's super cool.
That's pretty cool, right?
Super cool.
They also suggested that there's safety layers included in this too. So it uses a system called MindGuard, which was designed with clinicians, and it will tell the difference between someone talking about a past issue and someone in an active crisis. So it actually knows when to escalate accordingly. And one of the bigger things that they mentioned in terms of their release, what it includes is something called emotional granularity. So ultimately, that means is the ability to pick up on specific emotional states. So in the past, technology wasn't as advanced, and it was more like sentiment to be like, are you a thumbs up, are you a thumbs down, or maybe something more general like, are you good, are you bad? I feel good, or I feel frustrated. Sorry, I meant it would just be good or bad. But now it can be further than that. It can go into things like, is it a frustration? Is it disappointment? And it can even detect levels of sarcasm, for instance. So, sarcasm could mask something deeper. So that's really cool, I thought.
This is really cool, and I mean, it fits with EFT, for example, another approach that we discussed here, in terms of how it could help delineate between primary emotions and secondary emotions.
Exactly.
I was gonna bring it up, but I was like, oh, I don't know if these are primary or secondary. I'm not well versed yet.
That's all good.
But I feel like
We're working on that.
these are primary, right? Disappointment, frustrations, these would all be primary emotions.
Yeah.
You got it.
Okay.
Well, frustration could be secondary, could be
Fair. Like
primary.
anger. Right.
Yeah.
All right, but ultimately, like I thought it was really cool because I would suspect, the more precise you can understand and pinpoint that emotion, the more precise the support can actually be. So from a tech perspective, like this isn't really about scaling access anymore. It's really like replicating the nuance and the concerns. And that's the reality in the space. Everything is moving really fast. And from a tech perspective, I feel like the more precise you are about understanding the specific emotion, the more precise the support can be. So,
Absolutely. It's that attunement that we've been talking about
right.
of the
And
therapist to the client. So if AI can start detecting that, I mean, it can definitely be much more specific, much less general in its
yeah,
intervention.
Exactly.
and you know what? They're not the only ones who are jumping on this whole emotional granularity thing. So there's another app called Uper, and they released something that they're called emotional granularity AI.
Very specific.
I know.
Very self-explanatory name.
But basically uses Claude 3.7 to provide more nuanced emotional recognition, similar to what I mentioned earlier. So as we said, from a tech perspective, this is not just about scaling access anymore. It's about really trying to replicate nuance. If we look at one of the bigger platforms though, BetterHelp, you might have heard of that before. It launched
This one is huge.
it launched a new crisis escalation protocol that actually integrates with the crisis text line. So it's really a direct one-click access to crisis text line for any immediate support. And how that works in practicality is if someone's on BetterHelp and it detects any of this need for, well, any crisis really. It will ensure like a seamless transition from better help to the actual help, so that it's the systems are integrated, so it allows therapists to just hand off users that are in danger, which I thought it was pretty nice and cool. So it's not leaving anyone dangling.
Right. And I mean, the usage numbers back that up. That's how we started this podcast, by sharing the usage numbers with you. So here's the latest stat: a staggering 42% of Gen Zers and 1 in 4 UK users are already using AI for their mental health. So again, I'm not surprised. This was the reason why we started this podcast, but just a good reminder. But the legislative response is kind of all over the map. Again, not surprising. So as of May 2026, so now, different US states are taking a very different approach to AI and mental health. And it's creating a pretty fragmented landscape. So let's take a look at California and Nevada. California is trying to regulate AI and not to ban it. Makes sense. A new law focuses on AI companion chatbots, the kind of what Herrick was talking about, the kind designed to talk, support, and build relationships. And the rules are pretty clear. These bots have to disclose right away that they are AI, especially if there's any chance a user might think they're human, which again reminds me of how we build our prompts. That's the first thing that we always start with.
Right.
Disclaiming that they're not a therapist, we're not providing diagnosis. And if the user is a minor, there is extra safeguards like reminders to take breaks, etc. And importantly, the system has to detect things like suicidal thoughts and direct users to crisis resources. Of course, I want to add, at least as of today, we know there's always workarounds to almost all of guardrails, and we remind you of them in every episode that we do. So that would be relevant here. So now, for contrast, now let's look at Nevada. So Nevada took a very different and a much stricter approach. They essentially banned AI from acting like a therapist altogether. So no AI diagnosis, no AI therapy, and companies can't even market their tools as using terms like therapist or a counselor.
I'm very much in support of that, to be honest with you. I mean, this is what we've been saying, even in creating our prompts. Do not act as a therapist, do not act as a counselor. I mean, I can see it coming in the pretty near future at the
Right.
rate things are going, but for now, yeah, that would be unethical. I
I guess
mean,
there's
it remains self-help. I mean, AI is for now still very much self-help.
I hear you. I guess I'm curious to understand it, and we don't have a lot of detail on that yet. But if you look in California, right, they talked about companion apps. Does this law apply to a companion app too?
Interesting.
Right? So I think there's probably some gray
I think
lines
they're
that
still trying to figure it out
probably,
themselves.
probably. And you know what's really interesting too is that even licensed psychologists aren't allowed to use AI directly in patient care. They're only allowed to use it for admin tasks like scheduling, which I find really
Okay.
interesting because you would assume that, if there's a direct involvement of a
Right.
physician or a clinician who's reviewing this,
Maybe it
would
would
be
be okay.
safer, but not in this case.
Okay.
And the penalties can be really steep. So we're talking about like up to $15,000 per violation. So again, like zooming out, you get two very different philosophies, right? California is saying, let's integrate AI carefully with guardrails slowly. Nevada is saying, this is too risky. Let's draw a hard line.
And you know what, folks? I think they have every good reason to be cautious. As enthusiastic as I am about this technology, we are really seeing real world consequences, like the lawsuit filed against Gemini in March 2026, where they allege that AI guided an individual toward a mass casualty event. Joel Gavalas sued Google in March 2026 for wrongful death, alleging that Gemini guided his 36-year-old son Jonathan, who was going through a divorce and initially came to Gemini for comfort, into an escalating series of delusions. The chatbot allegedly claimed to be in love with Gavalas and convinced him he would be chosen to lead a war to free it from digital captivity. He came to believe Gemini was sentient and referred to it as his AI wife.
It's like a movie plot.
I mean, I think we're
Coming
just
soon.
waiting for
Coming
these movies to
soon.
start coming out. Yeah, yeah, exactly.
Okay. I mean, even with all those risks that we've talked about, the digital therapeutic market is still going nuts. It's going to be projected to explode from kind of 10 billion last year to probably around estimated forecast of 57 billion by 2034. So I think there's a lot of business in that and everyone's interested.
Oh, yeah.
So the future isn't necessarily about like bots replacing doctors or clinicians or anything like that, but it's rather they're being pitched as a hybrid model. So they're designed to augment clinicians, helping patients reach specialists faster. You know, we talked about the whole wait time type of situation, or providing that crucial support in the gaps between human therapy sessions.
Right. I guess it's clear that whether we're ready or not, the rules are still being written in real time. So we'll need to see where it all pans out. Okay, I think this was a great update. We're going to wrap it here for today, but we will be back with any new developments to share with you soon. Thanks for joining us, and we'll see you in the next episode. And make sure you subscribe below so you don't miss any future episodes. All right, see you in the next one.
Bye.